Those under the power of drug and alcohol addiction have a crucial first step towards recovery. It's called the New Vision program. It's designed to help people safely manage withdrawal symptoms and detoxify. Now, Ryan Westerhouse from Trinity Health Grand Haven joins us this morning to share more about the New Vision program. Good morning, Ryan.
Good morning.
Thanks for being here. Let's start with this addiction. It seems to be kind of a twister, a hurricane, right? Sure. The first step in this is really medical stabilization. Can you explain what that is?
Yeah, absolutely. So we have individuals that come in, and oftentimes if somebody's kind of struggling with substance use, there's that physical health complication piece that comes along with it. That's where we come in. We have that ability to be able to manage their physical health while also helping these individuals detoxify from the substances that they're struggling with.
Absolutely. This is obviously mental health and physical health combined. All addiction dives in. So this is 24/7. I love that because obviously addiction's never taken a rest.
Yes.
So talk a little bit about it's individualized, the environment. What does the New Vision program look like?
Yeah, so it's a great question. So we believe in wrapping the services around each individual. So when somebody comes into our service, we do an individualized care plan for them. We start immediately looking at what is discharge, what does aftercare look like, what does that medical necessity piece look like, ensuring that we're able to really wrap all the way around that person, ensuring that their physical health is being taken care of, along with that substance use being taken care of, not just at our service, but ongoing.
And the duration of this, let's say someone knows someone who is struggling, or maybe someone watching right now is just struggling through addiction. What does that look like? I love how you start with looking at how it's going to look at the end.
Yeah, absolutely.
That's a great way to start. But what is somebody walking into? Their stay, this is inpatient.
Yes, correct. So an individual will typically stay on an average of 3 to 5 days through our service. That doesn't mean that they're there for 3 days and then they have to leave. That physician gets to determine when they are medically stabilized and medically baseline enough to go to those next steps safely and making sure that aftercare is truly set up and ready for them to go right on to their next steps from our service.
And that really is key because getting to that next step, the stabilization has to happen. So many times people jump to that next step without being stabilized first. So talk about the environment. I mean, this has got to be a safe place.
Correct. So we're located right inside the Trinity Health Hospital in Grand Haven, Michigan, and yes, it is an inpatient stay. They are in a hospital room right on the medical surgical floor, just like any other patient. They are not secluded, they are not segregated, they are right with us, and we make sure that they have that 24-hour supervision that we have with the physicians, nursing staff. Everybody really makes sure that they're wrapped around and those individuals are safe, well taken care of, and making sure that they're monitored throughout their entire duration of stay.
And we know that addiction is sometimes a stop and start.
Sure.
Addiction, sometimes people stumble. Yeah. I'm assuming there's support for when that happens.
Yes, absolutely. So we're there. We have individuals that come in, and unfortunately sometimes they come through our service a couple of times, but that's totally okay. We're here for these individuals. We try to make sure that we monitor them during the stay, and then of course even after the stay that they're here. We get them connected to those ongoing services, but we also ensure that we're monitoring them and making sure that if they do happen to falter or take a step back, we're there for them to make sure that we can get them to that next step again.
Yeah, that might be labeled under complications.
Absolutely.
Right? And this reduces that, right? You have a support system there. It's accessible 24/7. How can someone watching this right now access this program?
That's a great question. You would literally just call us at 616-358-4877, and we will be able to get them in. We are a Monday through Friday service, so keeping in mind that we are able to get individuals in through that 8 to 5 Monday through Friday, but we will go ahead and make sure that we can get them in as soon as possible. We try to get every individual that contacts our service in within a 24-hour period.
Phenomenal. That was my next question. It was like, how quickly can I see you if I go? So within a day, you can get that help that you need.
Absolutely. So substance abuse is one of those things where individuals can change their mind quickly. And our goal is to obviously get these individuals, when they're ready for that service, we want to make sure that we're ready for them as well.
Absolutely. I love that. When they're ready, you're ready. 24/7. And you can learn more at trinityhealthmichigan.org/newvision all about this. If you want to become a patient and maybe you know someone who needs this help, the phone number's right there on your screen, 616-358-4877. Ryan, thank you so much for the talk.
Appreciate it. Thank you.
We'll be right back.